Good morning, good afternoon, wherever you are. My name is Justin T. Pierce with Federal Employee Benefit Advisors. It's my privilege to host you today along with my colleague and friend, James Campbell, who I'll be introducing to you shortly. We've got about 45 minutes of really good in-depth information on FEHB and Medicare and how to maximize both of those great benefits. So without further ado, let me tell you a little bit about our housekeeping today. So we're going to discuss with you, like I said before, FEHB and Medicare, focusing on how to minimize your health insurance costs. There's several different strategies you can take advantage of as it relates to these federal benefits. And we're going to look at all the different options and which one might fit your situation best and what might look like the best situation down the road. And without much fanfare, I just want to make sure that you understand that we have turned the chat feature off. We're not going to do a Q&A session like we normally do at the end of our sessions. So if you do have questions, if you do have concerns or comments, there'll be ways that you can contact us via email and also during a consultation. So let me tell you a little bit about myself. I am living here in Charlotte, North Carolina. I used to live in Tucson, Arizona for most of my life. Recently moved here last June. My wife there, Rachel, and my 4 children, Alyssa, Zach, Maddie, and Lily. Yesterday was Lily's birthday, and we had a great time riding some horses with her. I am a fiduciary and a federal retirement consultant. This is very important to understand. A fiduciary is someone who is in the financial advisory world, if you will. And unlike most advisors who do not have a fiduciary designation, fiduciary means that I'm held to the highest ethical and legal standard in the industry. And we are in the minority. And where we really separate ourselves from the rest of the pack is that we remain independent. So I don't work for one company. We are not recommending something that Edward Jones or Merrill Lynch or Morgan Stanley says that we should recommend. We are not captively employed by one specific financial institution. Because when that happens, you've got good advisors, don't get me wrong, great folks who are in those roles, but they're limited with what they can offer you. They're not allowed to show you certain things. So as a fiduciary, it allows me to work independently, and I can work with the top 50 financial institutions and recommend the top 3 companies in whatever field or whatever scope we're recommending, and that helps eliminate any conflict. And folks, that's also how we're compensated. There is never any fee when you meet with us, and there's no fee for any of our education, no fee for any of our advanced planning as we do along the way. And that's because we're compensated by the financial institutions we represent, so not by you. Now, as a federal retirement consultant, this is a professional designation that I have, and that all of our federal retirement consultants on our team have. And it's like a CFP or an MBA. It's some sort of official designation which indicates that we are certified to train federal employees on their federal retirement. It's a rigorous testing and study material that we have to get recertified each year. So basically, financial planner built specifically for federal retirees and federal employees. I've been helping folks in the federal sector for about 15 years now, since January of 2008. This is something that I'm very passionate about doing. All of our clients are federal employees or their spouses or direct referrals. We do not work with anybody else in the private sector. We work exclusively for federal employees. We do a lot of workshops. We do a lot of webinars. I'm going to invite you to a webinar that we're going to be doing next Tuesday on your benefits as a whole, all 6 main federal benefits. We're going to take a sort of a macro look and down at that and take a peek at your benefits with the 10,000-foot view. And I'm also in charge of making sure that we run different programs as it relates to seminars and union workshops. And we facilitate a lot of one-on-one virtual consultations each week, and that's the best way to better understand your benefits. I'm also the co-author of the book, The Informed Fed. I was asked to author this back in 2019. It's about 155 pages, really good book on more information about your benefits and retirement, and I'll explain how you can get a free copy of that later on. And finally, myself, James, anybody else that you might talk to are not federal employees. We are not hired by OPM. We are not compensated by the government in any way, shape, or form. We are allowed to do what we do, but we are not paid by the government. So please understand that. And now, without further ado, I'm going to introduce you to our co-host today, James Campbell.
Hey there, everybody. Hope everyone's doing well out there today. Hope fall is treating you well and getting ramped up for Halloween. I know we're very excited about that here in my household. It's one of our favorite holidays. So Just like Justin, I'm a husband and father first and foremost. This is my wonderful family. I'm so blessed to have my wife and 3 kids. I carry all the same designations and qualifications that Justin does: fiduciary, federal retirement consultants. I only work with federal employees. I help with that informed Fed also. And like Justin said, we're going to let you know how we can maybe get you a free copy of that, a PDF copy of that. And I'm also not a federal employee. So pretty standard stuff there. This is some pictures of our team of additional advisors. There's millions of you, and there's only 2 of Justin and I. So through the years, we've grown a team of federal retirement consultants. These are all wonderful people. We highly encourage that you take advantage of our free one-on-one consultations to understand your federal benefits, your retirement. And so these are some of the lovely faces that you might see on a Zoom call or here on a phone call. And we've got a fantastic support staff. This is just a very small snippet of all the people that help us behind the scenes. So we really appreciate our team. General disclosure. So today we're going to be talking about health insurance and Medicare in retirement. So it's important to know that Justin and I are both securities licensed. We're both licensed in a lot of different financial realms. But today we're specifically talking about health insurance and Medicare. We carry health insurance licensures. I'm Medicare licensed, but on today's webinar, we're not going to be recommending any specific provider or plan. We're just talking about, as a federal employee, how do you maximize this and strategies you may want to think about. So just keep that in mind, that we're not making any personal recommendations to anybody today. We would have to know you and your personal situation a whole lot more to be able to go over stuff like that. Now, like we said, how can you get a free copy of this wonderful, plain English, easy to understand book? And it's pretty simple. We love to chat with you and learn your situation. So just by scheduling a complimentary 1-hour one-on-one consultation, we'll get you a free PDF copy of the Informed Fed. A lot of good information in there if you ever have a chance to go through it.
Thanks, James. And folks, let me explain to you the benefit we're talking about today. Medicare and FEHB, they're kind of combined, are just one of the 6 main benefits you have. And you have to understand, we've basically taken your entire benefits Bible, if you will, which used to be called the Federal Employee Almanac, and it's no longer produced. It was independently produced, and it was about the size of the Old Testament plus an extra 100 pages. It was really thick. And over the past 15 years, we've basically disseminated that into the most useful, topical, highlight information possible. And on our consultations, not only are we going to discuss your Medicare and FEHB situation and needs one-on-one, but we're also going to talk about your 5 other benefits, and they all kind of connect in one way, shape, or form. Like FEHB is connected to the survivor benefit annuity in an interesting way, so on and so forth. So this is the opportunity you have to talk with us one-on-one, unbiased. There's no obligation. We're not going to try and press you into anything. We're just going to get you really good information, spending about an hour together, running some income reports, looking at TSP and pension incomes, and it's definitely worth the time. And again, it's complimentary, and you receive a free copy of our book, The Informed Fed. Now, our next event, which is coming up Tuesday on Halloween, which you're going to get a link in the chat to be able to register for, is going to be on those 6 main benefits. So in the consultations, we take a deep dive. It's kind of like part 2. You're going to get part 1 on Tuesday, where you're going to get a brief overview with some useful information and a little, bit of information on a couple federal secrets that will go in on more detail and on the consultations. So this on Tuesday, October 31st at 1 o'clock is going to be about an hour-long session. And on these, we always have Q&A. So we'll do a live question and answer at the end of the hour, and you're going to be able to ask any question that comes to mind as it relates to your federal benefits, your federal retirement. And we'll stick around for an hour or two if we have to. We've done it for up to about an hour and 15 minutes at one point. So just depends on how many questions are coming in. So you'll get that invitation there in the chat.
All right, so on to the main event here. The main course, we're going to start diving into FEHB, your health insurance, Medicare. What are your options in retirement, and what are these 2 benefits exactly? Okay, and then we're going to talk about here's some main strategies that people do and can use. What I want you to keep in mind as we go through this, one of our biggest things is we want to protect your options in the future, because there's things that people don't realize. There's penalties or missteps that are irreversible when handling these 2 that may cause you to not have an option in the future, or cause a big penalty in the future. So it's really important to understand we want to, as best as we can, protect your options for the future. Okay, so keep that in the back of your mind as we learn what are these benefits and how can they work together. So first, let's talk about your federal health insurance, your FEHB, how to continue it into retirement. So the first most important thing to understand is that you need to, as the employee, you need to be covered by a federal health plan 5 consecutive years leading up to retirement. So that's just the entrance fee, right? And this is one of the best things that the government offers is you can be eligible for this for the rest of your life at the employee rate as long as you meet the certain requirements. So this is the first most important one. You got to carry it. So your qualified family members can also be on these plans with you. That means if you have dependents that are qualified, they can be on the plan with you. Of course, your spouse can be on there. And the spousal one is something that most people understand. They think that their spouse has to be on the plan 5 years leading up to it along with them. That's not the truth. It's just the employee, okay? As long as the employee themselves has been covered for 5 consecutive years, you've now locked in your ability to have the access to these plans for the rest of your life. So please don't miss that that opportunity to lock in. So the government, when it comes to your health insurance costs, doesn't matter if you're working or retired, they cover about 72% of the actual cost of the premiums. All right, a lot of people don't realize how much the government is paying towards this benefit for you while you're working or while you're retired. So that number you see on your pay stub, on your leave and earning statement, that's only about 28% of the actual cost of that plan. All right, so this is a big benefit. They're throwing a lot of money at your health insurance. So we want to protect that. And so when in retirement, there's only 2 main things that actually change on how this works. It has nothing to do with options, coverages, costs, all those stay the same. So here's the 2 things that change in retirement. First of all is frequency of billing. When you're working, you get 26 paychecks a year. So they can take your annual premium cost divided by 26, and that's what you see coming out every other week, okay? In retirement, you're only going to get 1 paycheck per month. So they've got to take that same annual premium, divide it by 12 instead of by 26. So some people kind of figure this out and they just double their biweekly costs and think that's going to be their monthly, and then they're surprised when it's more expensive than that. So it's a little more than double what you'll pay per paycheck would be your once a month deduction. Now, the other things that changes here is that in retirement, it's post-tax dollars that pay for your health insurance. So while you're paying the same dollar amount annually as the employees, your cost does go up because tax has to come out of those dollars before you pay the cost. Okay, this is very important in understanding for planning. Now, that's obviously just a quick overview of FEHB. It's very easy to understand because those 2 billing things are really all that changes. Okay, now Medicare. Not very many people really understand the Medicare or its parts or what they do or what they're meant for. So we're going to go through and just cover each one of these so that you have an understanding. What is Medicare? What are the different parts? What do they cover? First of all, most people are eligible at age 65, unless you have a disability or something like that. For all intents and purposes, what we're talking about today is retirement, someone that works their career and then retires. So you're eligible at 65. This is optional unless you are a postal employee. A law went through, or I'm sorry, a bill went through that changed. Now, postal employees in retirement are required to take Medicare A and Medicare B. Everybody else that's a federal employee is not required to participate in Medicare. It is optional, okay? Important to know. There are 4 parts to Medicare. Medicare A, B, C, D. We're going to break those down one at a time. Don't worry about that. We're going to make sure you understand what each one of these parts are. Now, if you participate in any part of Medicare while you're still working, this is going to be secondary coverage, meaning that if you're employed, you have FEHB, normally, and Justin's going to cover this, you'd only have Medicare A if you're still working. If you go to the hospital, let's say, your FEHB is going to be the first payer, okay? All the bills go through them. Whatever they pay, they're going to pay. Anything that's left over, Medicare would be a secondary coverage that might pick up and continue to pay some more. Anything that's left over after both of those, you would pay the leftover, okay? Now, when you're retired, it flip-flops. If you have Medicare in retirement, that's going to be your primary coverage. They are the first payer. So everything has to go through Medicare, Medicare-approved doctors, etc. And anything that goes above and beyond that, then your FEHB, if you're carrying that, would be the secondary coverage. All right. Now, Part B and Part D have premiums. There's costs associated to those. So we'll get into that here in a minute as we go through those individual parts. All right. So Justin, how about you teach them about Medicare Part A?
Of all the Medicares, Part A is my favorite, James. So thank you for allowing me to do this. Okay. So Part A, folks, as you probably know, if not, it provides health insurance. I'm sorry, it provides hospital insurance. Basically, like he was saying, if you're working, let's say you're 66 and you've got Part A and you've got FEHB is going to cover most of the cost if you go to the hospital, and then Part A is going to pick up the rest of the tab. It is completely premium free, with a caveat there of for most people. So if you haven't been working for 10 years prior to age 65, you will actually have to pay for Medicare Part A. And there's a surprising number of people like that because, you know, some folks just aren't in the workforce for one reason or the other. Stay-at-home moms, folks that just, become gainfully employed later in life. So the costs on Medicare Part A are actually pretty high. Most people don't have to worry about it, though, because most people have been working, paying into the system for 10 years prior to it. Now, as soon as you turn 65, it can become effective if you sign up for it ahead of time. So Medicare Part A, similar to Medicare Part B, allows you to register and sign up for Part A 3 months before and then 3 months after. Okay, so if you want to have it ready to go as soon as you turn 65, sign up for it 3 months before your birthday. And on the next month, kind of like I had said, within the next 3 months, if you wait till 65, you still have the opportunity to enroll in it. And whenever you enroll in it, it'll backdate it up to 6 months. So let's say you missed the 3 month benchmark after age 65, you do it a couple months later, they can go ahead and retroactively backdate it for up to 6 months after that. So again, Part A, pretty much free for everyone other than the select few who haven't been working the last 10 years. You got a 6 month window, 3 months prior, 3 months after age 65. It's a good idea to enroll in it no matter what, just because of the way that the coverage works, whether you're working or not working. So if you retire at 62, of course, there's nothing to do until 65 or 3 months prior. But those are kind of the deadlines there: 3 months prior to 65, 3 months after. Okay, so Medicare Part B, this one's kind of the one I get the most questions on as it relates to how it works and what to do with it. So I'm going to cover this in a little bit more detail. So Part B provides medical insurance, going to the doctor and any sort of medical type coverage that needs to be provided. You don't need Medicare Part B while you're working. Okay, so there's a fluctuating range of cost for Medicare Part B, and instead of just putting this giant slide up there with all the costs, I was going to go over it with you folks and kind of let you know that when you do a consultation with us, when we discuss your Medicare and your FEHB benefits and needs, if you're retiring within the next year, you definitely want to sit down with us. Even if you're over the age of 60, at any point, we want to start preparing for this. So everybody's situation is different, and this will be a range of cost of how it stands now. It might change next year, but this is how it stands now. So if you're making $97,000 or less as an individual, and you can about multiply this by 2 if you're a married couple, and the same range will apply, you'll be paying about $164 a month for Part B. 97,000 to 123,000, you'll be paying $230 a month. 123,000 to 153,000 annually, you'll be paying $329 a month. 153,000 to 183,000, you'll be paying $428 a month. 183,000 up to 500,000 in annual income, you'll be paying $527 a month. And then if you make over 500,000, you'll be paying $560. That's the upper limit there. So a range of about 164 to 560. Federal employees are on average paying about 164 to 230 per month. Now, when you turn 65, that's when you can sign up. If you're working, though, as a federal employee, you don't really have to worry about that. Okay, so federal employees, as you probably know, are exempt. Some folks don't realize this. So if you're sitting out there and you didn't know that, you didn't have to enroll in Medicare Part B because of that penalty. So if you are a private sector employee or you're retired and you don't enroll in Medicare Part B, every year that goes by, they're going to charge you a 10% penalty for when you eventually do enroll in Part B. They'll start charging you 10% per year that you waited. Okay. And so James is going to discuss, and I'm going to sort of piggyback on top of that a little bit later, the reasons why, even though you think you might not want Part B or might not need Part B, you might not need it or want it now, but you might need it or want it down the road. And there's several reasons to consider, which we'll get to in a second. So just like Part A, though, you've got the 3 months prior, the 3 months after age 65 to enroll. So if you're retired, we recommend that you get that. That way you don't have to worry about the 10% penalty, and we're going to give you the reasons why it might be something to consider. But everybody's situation is different. So for most folks, it might be a good idea, but not for everyone. So that's where discussing with us your unique needs and goals would be helpful with making a plan for this, because it is part of the plan. It's part of the retirement plan. Every single one of your 6 benefits requires planning, and it requires knowing what the nuances are. We've got about 3 or 4 federal secrets that almost no federal employees know about that we go over with folks during our consultations, and we show you things. This is just a highlight of one of them that you're going to see in a little bit, called FEHB maximization, that you're going to probably have never heard of before. And so we want to make sure that you've got all your options. Okay. So I think that's pretty much it as it relates to Medicare Part B. So I'm going to go ahead and turn it over to James here, and he's going to finish off with Part C and D for us.
All right, thanks, Justin. So Medicare Part C, also now known as Medicare Advantage. All right, so what Medicare Advantage does is approved private sector companies will combine original Medicare A and B coverage. You got your hospital coverage, your regular medical health insurance coverage, and then some will have additional coverages above and beyond that. Okay, the really important thing to understand about Medicare Part C or Medicare Advantage plans is that a large majority of them are premium free, meaning that you would just pay for your Medicare A and B, which is a prerequisite. You have to have those two to be able to get onto a Medicare Advantage plan. But then that would be your only cost. Okay, and what we're going to start talking more about later is the different combinations of these in retirement that you're going to have to choose from. You cancel FEHB and just do Medicare. You can do just Medicare A and FEHB. We're going to get into all those different combinations, but it's important to understand right now that Medicare Part C, which is going to be one of your options in retirement, has 0 monthly premiums for most coverages. There's an annual election period, AEP, and that's actually going on right now. Every year it's October 15th through December 7th. So this is when people can change the plan that they're on or enroll for a Medicare Advantage plan for the first time. So that's currently happening a lot. You're probably getting a ton of mail in your mailbox if you're anywhere around 65, right, from all these different people trying to talk to you about Medicare Advantage. So like I said, they combine traditional A and B coverage. Some will going to do some additional coverage on top of that. And it's important to know that depending on your region, there's going to be different carriers that operate in your region, and those carriers can have different plans that can vary by region. So there's a bunch of different options when it comes to Medicare Advantage. You'll need to talk to somebody. If we get done going through all this and you think, that strategy might actually work for me, you need to talk to a licensed Medicare agent that can look up your area and see what's available for you, which providers, which plans are available. All right. So Medicare Part D is prescription drug coverage. All right. And you have to have Medicare A and B, or just A or just B. You got to have A or B or a combination of both to be eligible for Medicare Part D. If you're on an FEHB plan, you don't need this, right? Because your prescription drug coverage is covered through that. But if you start using some of these other strategies, you'll have to understand what Medicare Part D is, what it covers, and all that kind of stuff. So standalone Part D plans have premiums. And just like Medicare Part B, if you don't get involved with the Medicare prescription drug coverage, when you're first required to make the decision, which is at 65 or within 8 months of retiring, then there's going to be permanent increases to this. So this one's, the increases are actually more stringent than B. These are 1% permanent increase per month that you delay. So if you wait 12 months, you've got a 12% permanent increase in your cost of the Medicare Part D. Okay, so obviously very important for planning and understanding. This also has the same annual election period of October 15th through December 7th. All right, and I think that pretty well covers what Medicare Part D is. Now, Justin, could you please introduce the three main combinations of these three, or these two?
Sure, yeah. So I'm noticing in the Q&A that we're getting some questions on exactly this. What do I do here? What do I do there? Right. So these are going to be generic, kind of boilerplate strategies. Sometimes one specific situation within a specific federal employee and their spouse, it might be a little bit different. But these are the three strategies that we recommend and the reasons why you consider them. And the first one is to keep FEHB and enroll in just Part A only. All right. So this is talking about retirement, right? So while you're employed, FEHB, of course, and Part A if you're 65 and older, but now we're talking about the retirement aspect of this. So in this strategy, so basically I'm going to cover the three strategies and then I'm going to go back to each one and explain the why and the how, okay? So the second thing that you can do with FEHB and Medicare is to, of course, keep FEHB and then enroll in Medicare Parts A and B. Okay, so if you have a Cadillac health insurance plan with FEHB, the highest premium, the highest benefit plan possible, generally you don't need Part B. Okay, Part A, of course, because it's free, but Part B isn't needed because everything that Part B would help cover, the Cadillac FEHB plan is already covering it. Now, I can't speak for that being 100% of the case, but most of the time that's what we see. So before you retire, understand, what is my plan? Is it the best of the best? Is it the most expensive? Or is it one of the more basic or moderate plans? If it's a basic or moderate plan, it's best to have Part A and Part B because Part B is going to cover some gaps in coverage left over from FEHB in retirement. Okay, so you'll get more bang for your buck, if you will, though. Even though there's a cost for Part B, it's definitely worth it. Now, the third option is to do what we call FEHB maximization, and that's to suspend FEHB. So, folks, you have the ability to keep FEHB in your back pocket. All right, you can suspend it, you can put it on the back shelf, if you will, and not cancel it and do something else health insurance wise. And the third strategy, called FEHB maximization, is to suspend FEHB and enroll in Medicare Advantage and still pay for Medicare Part A and Part B, okay? The main advantage to this is the cost savings. So with FEHB, you've got your monthly cost, which is now, biweekly, then it'll become monthly in retirement. When you suspend FEHB, the cost goes away, but you also don't have coverage. That's where Medicare Advantage comes in. The nice thing about Medicare Advantage is, for the most part, there's zero premium for it. It's fully subsidized by the federal government, okay? So you save a lot of money on health insurance that way. Of course, you still have your Medicare Part B cost, which again is a range between $164 and $230, but that's it. So this tends to be the lowest monthly out of, a sort of like upfront premium cost for folks. Now, that'll save you quite a bit of money, but the disadvantage to advantage, if you will, is you're limited to the coverages, right? So you have to work with a Medicare doctor. So if your current doctor or your current set, suite of doctors that you're working with aren't offering their services through Medicare, then you won't be able to work with them. So before making a decision like this, you always want to sit down with someone like us who has a Medicare specialty team waiting to talk to you, who can show you the nuts and the bolts. Here's what the FEHB plan covers. Here's what Medicare Advantage covers. And again, with Medicare Advantage, these are private sector plans. United, Humana, Aetna, just to name a few, but they're just subsidized through the government. So we can take a look and see the different coverages, the different different procedures, the different out-of-pocket costs that you'll save or might not save, and then decide, okay, it might save me some money to move forward with Advantage. And then the nice thing about it is there's no obligation, folks, because once you step into an Advantage plan, let's say 1 or 2 or 3 or however many years down the road, you're not satisfied with it, you can simply cancel it, no cost, no penalty, and then unsuspend FEHB and step right back into it as if nothing ever happened. So you're giving yourself more options when you do this kind of strategy. And you don't have to worry about locking yourself into any sort of commitment other than just for that 1 year. Okay. So going back to step one or strategy one, the type of person, the type of retiree that might want to consider just keeping FEHB and only having Part A is someone who travels a lot. And they might have multiple houses in multiple states. And the reason why we say this is because if you had Medicare Advantage, it's very localized. And they can kind of like get disconnected and disjointed, and coverages become an issue. And you know, who's paying what if you're in this state and that state. So it can be a little bit of chaos if you're constantly, you know, living in a different state, especially if you're going to be, you know, living abroad in another country. You don't want Medicare in that situation regardless. Okay, so strategy two, keeping FEHB and then enrolling in both Parts A and Part B, would be advantageous over to step or strategy three, because this type of person who would fit well in strategy two would have a lot of high health costs. You might be in the doctor's office a lot. You might have gotten diagnosed with a severe illness that's going to require a lot of procedures and a lot of medications. FEHB is going to cost you up front because of the premium, but it's going to cover more in the out-of-pocket back-end costs than Medicare Advantage. Medicare Advantage is going to save you up front, but it might cost you more if you're going to the doctor a lot. Okay, so if that's you, if you're medically compromised, you might not want to even consider Advantage because it might save you monthly in the premiums, but it's going to cost you more in the out-of-pocket. Strategy three is for the average person, the person that goes to the doctor the normal amount of times or even less than normal, right? No major illnesses. They're going to save quite a bit because of that by being on Advantage. It takes care of their needs, and there's really not too much excess surplus out-of-pocket costs that they have to worry about. But again, folks, as life changes, you can adjust, because even if you have Advantage, you're suspending FEHB. So if you get a major health scare and you've got some sort of debilitating disease that you're battling, you just simply drop Advantage and step into FEHB because you've suspended it, right? So that's why James is going to talk a little bit more on the next slide about having your options and why Medicare Part B is kind of an investment and to a certain extent Advantage as well.
Well said, Justin. For sure. Yep. So let's talk through FEHB maximization. Like Justin said, this is not for everybody, but a good majority of people, this is going to protect the most amount of options and keep your costs as low as possible, especially early in retirement. Okay. So important to know, if you're retired and then turn 65, or you're past 65 and finally retire, the first step is you'd have to enroll in Medicare Part A and Part B. And that would then make you eligible to sign up for a Medicare Advantage plan. And so then we would definitely recommend, once again, it comes to how do we protect against future potential penalties? How do we keep the most amount of options open? There's a good amount of Medicare Advantage plans. They're called plus prescription drug. So this is going to satisfy that Part D requirement, so that if later on down the road you wanted to be in a standalone Part D prescription drug coverage, which most likely you wouldn't because you're a federal employee. But we also want to understand, if we are going to suspend FEHB, we need prescription drug coverage, right? So that's why we say if we're gonna do this maximization, we want to make sure you find a plan that is Medicare Advantage plus prescription drug. Like we said, most of these are going to be zero premium monthly. Now then, suspend FEHB. This is such a crucial part that you have to get right, because if you cancel FEHB, you're done. You're never going to get it back. It's gone. Okay. So there is a specific form for this. We know the form. If you end up doing this, we could help you with getting the correct form, make sure it's filled out properly, so that once again, we want to protect your options for the future. Because let's be honest, let's step back for a second. We have no idea what FEHB is going to look like in 10 years from now. We don't. They could change what percentage they pay for it. The plans could continue to increase at a higher rate than the cost of living adjustment. Here's an important little number. I was looking at this morning. Since 2019, so 2019 through 2024, which we already know the plan costs and the COLA and all that stuff for 2024, the employee cost for FEHB has increased on average 5.4% per year. whereas your FERS cost of living adjustment has only been 3.3% a year. Okay, so this is one of the reasons why we want you to start thinking about the whole picture. If you go into retirement, most people are going to have a lower income in retirement. And now, your FEHB is the same annual cost, but now it's post-tax dollars. So that might mean it's 10, 15, 20% more expensive because it's after-tax dollars. And now year after year, your increase in your pension is not keeping up with the increase in the cost of your health insurance. Okay, so we just got to think about all angles. These are some of the reasons why we wanted to teach people about this and make sure you understand all of your options, okay? So anyhow, suspending FEHB, we absolutely must keep the option to go back to that if we go into this, because like we said, if later in life you start having major medical issues and your out-of-pocket is outweighing the benefit of the lower premiums, then yes, at the next open season, you absolutely want to go back onto regular Medicare A and B, reenact your FEHB so that your out-of-pocket is very minimal, if not zero. Okay, and that's what that last point where there was just talking about is if we do this, we want to know that we keep in the back of our mind we may need to switch back to the other option. But by taking this option to begin with, if it makes sense for your situation, it's just leaving you the most amount of options for later retirement. Okay. Yeah, let's go ahead and move on to the next slide there, Justin. All right, so cancel or suspend. Back to, there's a whole separate slide on this because it's so important to understand. Cancellation is permanent. You cannot undo it. So you just cannot make that mistake if you end up going with this strategy. Whereas suspend means that you have indefinite. There's 3 reasons why that you can suspend FEHB. There's the only 3 reasons OPM allows this. So if you're somebody that's on TRICARE, is eligible for TRICARE or CHAMP VA, you're allowed to suspend FEHB and do your coverage through TRICARE for life, CHAMP VA. Same thing. If later on down the road you decide, man, I missed that FEHB plan, in the open season, you can go ahead and hop back on it. If you are someone that is going to qualify for Medicaid, some state-funded programs, you can suspend FEHB and go on to that Medicaid. And the third reason why they allowed is Medicare Advantage plan, which is Part C, which is kind of what we've been talking about here. For a large percentage of people, that would be what we'd be talking about. Okay, so very, very important. Do not do anything about canceling or suspending until you talk to someone that knows what they're knows what they're doing, and make sure that you don't inadvertently cancel that coverage.
Very good, folks. We have just about 7 more minutes here with you, and I think that we're going to end a little early. We've got quite a few questions, about 25 of them in the Q&A. I've been responding to a few as James has been educating you. We'll try to respond to a few of them, but the best place to talk with us is during a consultation and getting all of your questions answered, not only on this great benefit, but on so many. One of the other things that we want you to think about as we take a holistic look at your financial picture, again, we are concerned about your federal retirement. We are not just concerned about your investments. We've been doing this a very long time. I love working for federal employees. I know how difficult it is for you to get good information out there. There's lots of people out there who claim to be helping federal employees, but all they really care about is your TSP. That's not the way that we do things, okay? We care about everything, and estate planning is very important. So if you don't have a living trust, if you don't have a living will, or what's known as an estate plan package, which includes both legal documents, plus a financial, medical, and durable power of attorney document for each of the family members, you're going to want to start doing that. You want to get those documents prepared. I always tell my clients about the time you retire is the benchmark, the time in which you want to get these things done. You don't want to go into retirement with loose ends hanging over your head, right? Get these things done because they're going to help your family avoid the costly, the time-consuming, the emotionally draining process known as probate. I don't know if anybody out there has gone through the probate process, but it is not fun. Estate planning is extremely important. And right now in this country, to get a really good estate plan done, it's kind of cost prohibitive because you're going to get charged $3,000 to $7,000 on average for a good estate plan. And unfortunately, it does. I guess I should say, fortunately, you don't have to pay that high cost to get a good estate plan done. And the reason why I say that is because my cousin's an estate planning attorney, so I kind of know how the sausage is made in that industry. And what happens is you sit down with an estate planning attorney in their beautiful office with their ivory, columns and their oak wood desk and all that good stuff. And they tell you everything they're going to do, and they do a good job with it. But what happens is they take that case, they take your request, and they turn it over to their legal document preparer in most cases. That legal document preparer is only charging the attorney like $40 to $50 per hour to prepare all of your legal documents. And then they turn it over to the attorney, and then the attorney sits down and presents it to you and says, here's everything we've done in this leather bound portfolio. And then they show you the bill for $3 to $7 grand. We can do the same work for you. The trust, the will, the powers of attorney, get you the same legal documents you need for about $1,500, because we're not trying to make money off of this. We're trying to help our federal employees. We want to get you as much of a discount whenever we can, wherever we can. So if you're interested, let us know. It's something we can also talk about during the consultation. And on that note, let's go ahead and just remind you one more time. We're going to put the link in the chat for you to schedule a consultation. Our team will be contacting you, following up, just seeing how your experience was today, and asking if you'd like to take advantage of the opportunity to learn a little bit more about your unique federal retirement situation. Even if you're not close to retirement, if you're 5 years away, that's okay. You can be making some moves to maximize your benefits for your future retirement and for your current situation. So just as a reminder, we're going to go over your 6 main federal benefits. We're going to talk about nuances. We're going to talk about 3 of the top 3 federal secrets, the federal retirement secrets that you probably don't know about, and then do some calculations with you, pension calculation, TSP income calculation, showing you what your incomes will look like. So you've got pension, Social Security, TSP income, so you know what your number is, so you can retire, hopefully when you want to, if not a little earlier. So you'll also be receiving a digital copy of that free book. And then finally, again, one more opportunity to enroll in our next webinar, which is Tuesday. James and I are going to be dressed up in our Halloween costumes. So if you attend, we expect you are as well. It's one of the requirements to register. No, I'm just joking. You don't have to. Of course, you won't have any camera on, so we won't know, but we will. We're just going to have a little fun with it. But it's going to be a good hour session. We're going to do a lengthy Q&A. You can ask us questions live about any of the benefits that we're going to discuss. So make sure you register for that, pass that around the office, and then James, I'll go ahead and turn it over to you here.
Yeah, we just really appreciate federal employees, all that you do to keep this country running. We are honored to be able to help educate you on what your options are, how to maximize your retirement, and all the different benefits. We'd love to hear from you. One of our biggest goals is to make sure that we are being effective and teaching people about the stuff they want to know, and that we're doing it in a good fashion. So we'd love for you to fill out our survey. You don't have to, but we'd love for you to fill out the survey that we'll send you. And if you do, we'll send you this little publication on top 10 mistakes made by federal employees as a way to say thank you for helping us to get better at what we do. And with that, we're going to go ahead, Justin.
Yeah, no, I was just going to say, I was trying to see if I had my thank you slide, but we've got a bunch of Q&A questions. We've got about 15 minutes. There it is. You want to just do a little impromptu Q&A, pick a few of these, James, or do?
Yeah, sure. We might as well. Let's just go ahead and hop on there.
We got some time.
I
got the first one here, folks. So usually we don't do this on our little lunch and learns and our little mini programs like this, but we do have got about 15 more minutes. So if you want to stick around, we're going to answer some of these questions live here and be done at 1 Eastern. If not, again, thank you so much for your time. We really appreciate it, and be on the lookout for more educational opportunities that we have right around the corner. Okay, so I saw a question by Joe, and Joe asked, do you help with retirement paperwork also? That is a great question. Absolutely, we do. There are several documents, several retirement documents that you want, and you want to get those 6 months prior to retirement. The 2 main ones that you're responsible for filling out as a FERS employee is the SF3107, Standard Form 3107. It's 20 pages long. More than half of these documents, when they get turned into OPM, get rejected. And that means your retirement gets delayed. So Joe is asking because he's probably seen the documents or heard about them. They're tricky. So we help folks with those. We make sure that all of the boxes are checked, all the I's and the T's are dotted and crossed. And that's part of our service. So if you're a client of ours, It's included. So absolutely, Joe. Good question.
All right, I got a scenario from Steve. Husband's Fed employee will not be retired for a few years past 65. I'm covered under his HSA plan. Need advice for what each of us has to take at 65 RE Medicare. If we have to move out of the HSA plan we are currently in. So, great question. There are rules about HSAs and I need to double check on this. Let me get back to you, Steve. As I started to answer this, I know there's some rules with FSAs, HSAs, and being on Medicare. So please schedule an appointment with us, Steve. I need to look into that and double check. I don't want to say anything incorrect or take a guess at it. Sorry about that. I should have finished reading it before I started answering it. Go ahead with the next one, Justin.
No problem. Sandra says the potential issue is that when considering FEHB maximization, the Advantage plan may not offer the same exact benefit coverage as FEHB. That's exactly correct, Sandra. It might not. And that's why before making a decision like suspending FEHB and opting in to Medicare Advantage, you want to sit down with someone who knows what they're talking about so they can use the software that's built to compare the coverages and show you, here's what you get, here's what you lose, here's the cost, here's the other cost, right? So before making a decision, that needs to be compared. Sometimes those coverages aren't important that they're not there. Sometimes they must be there. So good points, Sandra.
All righty. John said, I'm retired, going on Medicare in January, trying to decide between Blue Shield Basic and GIHA. So, John, during the open season of FEHB, you're definitely going to want to look at those and compare them. We would love to chat with you to just understand your situation, how retirement's going, and if you wanted to talk to one of our Medicare licensed agents that could help you look at that and to see if it's even a potential option for you, we'd be happy to do that. So I definitely recommend schedule an appointment with one of us so we can look at your whole situation and see if we can help guide you on that. We just can't guide you on the actual coverages of Blue Shield Basic and GIHA. So that's going to be something you have to work with the government on there.
So Sarah has a question. She says, let's see, where did Sarah go? If I'm retired, can you assist with Roth conversions advice? Absolutely, Sarah. So that's something where you're going to want to schedule a consultation with us. It's definitely advisable to see what your options are on that, for sure. That's something we do with our clients quite frequently. And then you got one, James? If not, I got another one on standby here.
Okay. Let me see, Frank. So all these Medicare additional coverages apply to our spouse, even if they are younger than 65. This is a wonderful question, and one of the things that you have to look at before you make any of these moves. No, if your spouse is on your health coverage and they're younger than 65, then unless they have coverage through like their employment, you need to stay on your FEHB until they're Medicare eligible. Then it opens up these options. So you don't want to suspend your FEHB if your spouse is depending on that coverage. Very good question. And like I said, this is part of why we can't make any blanket recommendations. We have to understand what your situation is before we can say, okay, out of the three strategies, this one might make the most sense for you.
Barbara asks, can I suspend FEHB if only using original Medicare? So Barbara, I'm going to assume you mean original Medicare is Part A and Part B. So if that's what you meant, then no, you can't suspend FEHB. Like James said, there's three specific reasons. One is if you're going to go on Medicaid. The other is if you're going to do Medicare Advantage, which is Part C only. And then the other one is if you're going to go on TRICARE or the CHAMPS VA program, which is, for military.
Just to piggytail on that. So Medicare Advantage gives basic original Medicare coverage. So if you're wanting to suspend your FEHB, you would need to enroll in a Medicare Advantage plan during this annual election period. And then you will still, the Medicare Advantage companies are required at minimum to give you the same coverages as original Medicare A and B. So you could still achieve that, but you have to take that extra step and show that enrollment to be able to suspend your FEHB. Just a little piggy tail. Sorry about that. Wanted to add a little detail. And with that, I'm not ready with another one.
Okay, I'll go with Francis here. So, hi, Francis. Can you please clarify? She says, if I have Part A and Part B and a very good Fed coverage with Blue Cross, Blue Shield, are you indicating that I might not need Medicare Part B? How do I further explore that? So, yeah, that is kind of what we're saying. So you're going to want to check your coverage. And, right now is perfect time, open enrollment season. So sit down with one of the Blue Cross health insurance experts in your office or wherever it is that you guys can talk to them and ask them what your plan is. Because usually, if it's the most expensive plan, the best plan, which covers the most, coverages, you don't need Part B, because Part B is there for folks that have basic to moderate. Okay, so just understand what you're paying for, and if it's the most expensive, then Part B is likely not needed.
Russell, I'm still working as a federal employee. When I reach age 65 and waive Part B, does the waiver specifically state that I am still working so I can enroll in Part B when I retire versus canceling Part B? Yeah, so you're just going to say, I'm still working. I only want Medicare Part A. And then they get a notification when you retire. Even though federal health insurance is different, it doesn't disenroll you from that plan like it would from a private sector, but it does still trigger that requirement. Now you're going to have an 8-month window to make that decision on Medicare Part B once you retire. If you wait beyond that 8 months and then decide later you want to take it, there will start being penalties if you don't do it within that 8-month window.
Okay, so Steve and Dan kind of asked the same question, and which is the cost. They want to know the cost for Part B again. So real quickly, folks, you're going to pay between $164 at the bottom level all the way up to $560 at the top level for your Part B costs. So if you're making $97,000 or less, it's $164. $97,000 to $123,000, it's $230. $123,000 to $153,000 is $329. $153,000 to $183,000 is $428. $183,000 all the way up to $500,000 is $527. And then if you're making over $500,000, it's $560.
And just as a tidbit of detail, that's for solo, right? For a single person. If you're married, yep, those are almost doubled.
Double it, yeah, pretty much, yep.
But once again, we'd love to chat with you, understand what your projected retirement income might be. Then we can figure out, okay, here's probably what your Medicare B cost would be. And back to, this is one of those things that helps us decide which strategy makes sense. If you're a really high income earner in retirement and your Medicare Part B costs are $560 a month per person, you probably don't want to do that. You could be on a premium FEHB plan in that case. So that would be another person that strategy number one would probably make the most sense if you're one of those people that would be paying $560 a month per person for Medicare Part B. Okay. Sorry, Justin, I keep chatting and then not having one ready.
That's fine. I got one here. Anita says, if FEHB is basic when retiring, can I switch to FEHB Cadillac in any open enrollment during retirement if I do not get Part B? Yes, you can. You absolutely can. You can switch every year in retirement, just like if you were working. The reason why we recommend folks get Part B, even if they have Cadillac or debating it, is because if you delay Part B, every year you delay after retirement, then you have to pay a 10% penalty. And sometimes things might change. FEHB might change. They might boost the prices up 30%. We got a lot of debt in this country, 33 trillion in debt. They got to get the money back somehow. So if you don't have Part B, and then 5 years later, you're like, oh my gosh, I need Part B, it's going to cost you 50% more. So it's not going to hurt you to have Part B. The cost might be a little bit of an inconvenience, but it's an investment in your medical future, we like to say.
Yep. All right. So I joined at the end of Part B presentation. I'm retired, but signing up for Medicare when I turn 65. What's my penalty for adding Part B? Well, if you haven't turned 65 yet, there is no penalty. You're retired. Joan, sorry, I forgot to say who this was. Joan, sounds like you're retired and you're not yet 65. So 65 would be your first juncture where you need to make that decision. So if you take on Medicare B at 65, there is no penalty. You're paying whatever cost your income puts you, whatever bracket your income puts you at. We'd love to chat with you about that, Joan, to just talk about the ins and the outs and make sure you understand that.
Okay, so Dan says or asks, my wife and I are both federal workers. Usually it is slightly cheaper to have individual FEHB plans. That is correct. What would that also be true with Medicare? So Medicare is, household, right? So if you're married, and you're filing jointly, or if you're married but filing separately, the cost is going to be the same for both of you because it's the same income. Okay, so if you're both making, let's say, $180,000 combined, you'll be paying about $230 per person. Okay, so it's the same cost because it's the same income.
All right. So Lewis, my wife is 10 years younger than me, so she would not be covered by Medicare. Can I suspend my FEHB coverage to get an Advantage plan, or will this leave her without coverage? That's one that we kind of covered earlier, but I really wanted to circle back to this because it is important. When you got a spouse that's younger than you and they're depending on your FEHB coverage, you do not want to suspend that. They've got to get to 65. So that you can both go on to Medicare. You don't want to leave them high and dry on their medical coverage.
Very good. So let's see here. I had it and then it just went away. Okay. Let's see. So Jeanette asked, when you said you had to be working for 10 years prior, I do not remember what part you said that for. So Jeanette, that was for Medicare Part A. Medicare Part A, which at age 65, people are eligible for, and it is free. The premiums are zero cost, but you need to be working for at least 10 years, paying into Medicare and Social Security for at least 10 years in order for those premiums to be free. So in most cases, it's free for everyone, but if you got started late in your career, late in your life, you only have 7 years of employment, then you turn 65, you're going to have to pay a pretty high fee for Part A.
All right, Rolando, I'm past 65, still working. I thought I have 8 months after retiring to enroll in Medicare Part B. Correct? Question mark. Yes, you are correct. So anyone that's out there still working past 65, do not panic. If you don't have Medicare Part B, you're doing the right thing. It's most commonly advised not to get Medicare B until you retire, and then you'll have that 8-month window to elect it if you want to and avoid any late penalties.
So we just got about 1 more minute to the top of the hour, folks. This is a lot of fun. We could probably stay on here for half the day, James and I helping you out. But again, if we can't get to you right now, we can definitely get to you in a consultation. We'd be happy to do that for you. So Joe asked, once you sign up for Part B, do you have to stay on it forever? No, you don't have to stay on it forever. It's advisable to keep it. You can cancel it, but it's not like they permanently affix it to you.
Awesome. All right. There's just so many good questions. We are out of time. We got to get back to our regular schedules here. But thank you so much for everybody for attending, for hanging out, for asking all these wonderful questions. If we didn't get to your questions, we would love to still chat with you. By all means, schedule a one-on-one consultation. They're free. There's no commitment. We're just here to give you good education, teach you about your federal benefits, and start to teach you about some of these secrets and learn more about you and possibly help you maximize your federal retirement.
Well, thank you very much, folks. Our pleasure. Again, we've got another webinar on the 31st. You've had a chance to get that link. You'll still get that information sent to you so you can sign up. Really appreciate you. Have a great weekend, and we'll talk to you soon.